Clean health, healthy living, illness prevention, and health awareness with Dr. Oby Coucou.
Hello everyone, you're welcome to yet another episode of Clean Health. My name is Dr. Oby Coucou, a consultant cardiologist and a fellow of the West African College of Physicians. I'm glad to have with me here today once again a special guest in the person of
Farouk Bello.
You're very welcome, Mr. Farouk.
Thank you once again.
Yes, can you tell them who you are?
Of course, as always, I am that journalist, that development practitioner, and of course a public analyst who is very much interested in health communication.
Beautiful. Welcome once again. Today we will be looking at a special topic. Apparently
today is a special day.
Yes.
Because by virtue of what I'm seeing right before me, you got something different to share with the listeners. The viewers out there.
Yeah.
Yeah.
So we'll be talking about the prevention and control of hypertension, and we'll come down to your level as a Nigerian, an African.
Yeah, well, I wouldn't say a Nigerian and of course an African, given the fact that this video is targeting a whole lot of people.
All right. But you know that...
from different continents.
Sure. But you know that some of the vegetables present here are peculiar to Nigerian Africans.
Yeah, but I'm thinking that the cucumber I'm seeing over there could be consumed by any other person.
Of course. Okay, so fine. Let's leave it that way.
The cucumber, the carrots,
sure.
the vegetables, I think other people
the
from...
The garden egg, right?
Our brothers and sisters from the other side could be also
correct.
very much interested.
So in other words, I would like you to pay rapt attention, okay? So thanks very much for watching. Kindly click on the like button, subscribe to the channel, share those videos to your friends and relations, and lay your comments in the comment section. Stay tuned. We'll be right back.
Clean health, healthy living, illness prevention, and health awareness with Dr. Oby Coucou.
Welcome back. So over to you, Mr. Bello.
Oh yes, well, as always, I always have the honor to guide the discussion, as you put it.
Yeah.
Now I can see before me a lot of things here, a lot of vegetables, which I believe are part of what you will tell us today regarding how we can manage hypertension, treat and manage.
Prevention.
Because I think there are two things here.
Prevention and control.
Yeah, prevention and control.
Yeah.
So we can avert it, we can as well manage it in the event we get it. So why do we have these things today?
Before I go to this, I would like to tell you, how do we prevent hypertension?
Yeah, first of all.
Yeah.
Because I am just eger to know more about some of these things.
Don't worry, you have a full day.
Oh, okay.
Now, how do we prevent hypertension? We'll identify those risk factors we've talked about in the previous episodes.
Yeah.
And then we'll tackle them one after the other.
All right.
For instance, we talked about obesity. So we have to do exercise. It's recommended for all of us to engage in exercise, aerobic exercise, okay, at least 3 times in a week or 5 times in a week as recommended by the World Health Organization.
Okay.
And this includes jogging, brisk walking, okay, swimming,
okay,
all right, exercise that will make you sweat. Sometimes when you talk to patients, they'll say, but I'm always sweeping the house now. I'm cooking in the house, I'm busy. That's not enough exercise. You need to do exercise that will make you sweat.
Hope trekking is one of it.
Yes, brisk walking.
Oh, okay.
Good. So exercise, very important. Then subsequently, if you take alcohol, please stop alcohol. Not good for you. If you smoke, stop smoking. Alcohol, there is a recommendation though by the World Health Organization that you can take. You're allowed to take. This wine glass.
But that is if you must take.
Yes, if you must take, because there are people that are addicted to alcohol. Now you tell them to stop taking. It's very difficult. It's not easy.
Yeah, I understand that.
Right? Yeah. So you can take a wine glass of red wine.
Very small.
Very small. The small white glass. Bitter red wine. 2, not more than 2 of it for men on a daily basis is cardioprotective. What does it do? It increases the good cholesterol, known as high-density lipoprotein cholesterol. That's a good cholesterol.
This is indeed very amazing.
Yes.
Because I'm hearing this.
It will increase its level, and
Okay.
it protects the heart against damage, against heart attack, against every heart disease. Okay?
So
Then-
depending on the level of consumption, it has its own advantage.
Yes, just a
Okay.
little. For
Okay.
women, just one. For men, just 2 small glasses. Just small, very small glasses. Right. But it's better to abstain from taking alcohol or smoking. Then we'll talk about also sugars. Avoid sugary drinks, canned drinks, fruit drinks. All this. They contain a whole lot of sugar.
Sometimes you mentioned these drinks. This energy drink. Sometimes people will consume them, saying that they need to stay late up, in the night
it's not good
because
for
they
health.
have works to do, or they need more energy for them to be able to carry out
It's
a
not good. It
particular
has
task.
a high level of glucose, sugar.
Okay.
And sugar will predispose you to diabetes and subsequently predispose you to hypertension. Please stop it. Coffee, intake of coffee, and then even this cola. This cola to keep awake. It's not good for health. So please stop all that. There is what is known as the diet, the dietary aspect.
That's the part
what we're going to look at now.
I've been waiting for this moment.
Yes. There is what is called the DASH diet. Can you repeat after me? DASH diet?
DASH diet?
DASH diet, yeah. Dietary approaches to stop hypertension.
Oh, so is that
That's the meaning
particular
of DASH.
pattern?
It's dietary D, approach is A, to stop hypertension, SH, okay, the DASH diet. So it's a recommendation that
What
you
a
should
coinage.
take, yes, fruits and vegetables, very important. So you should have 5 portions of fruits, 5 portions of vegetables. You should have whole grains in your meals.
Why I'm actually very interested, I'm a typical African man.
Yes.
I love swallow a lot.
Oh, good.
And
Yeah.
from what I have seen here, most of them has to do with swallow. So that's why I'm very interested in.
So don't worry, we'll get there.
Knowing.
We're going to get there.
Okay.
Okay. So you should take whole grains. Okay. Nuts.
Okay.
Then of course chicken.
Okay.
But fish is good.
You should remember to peel.
Remove the back of the chicken.
Okay.
So fish is very good.
Okay.
Different types of fish is available.
Okay.
Chicken. Then vegetables, fruits and vegetables, very important. You know what this contains? They contain potassium, calcium, magnesium, some iron, some multivitamins, A, C, E,
Wow.
K, anti-inflammatory, perfect for health. In any food you're eating, any meal you're eating, please make sure you put vegetables. They will help to reduce your blood pressure. So we're going to do a range of them.
Okay.
To come down to nitty-gritty so you can get what we're talking about. For instance, have you seen this before? What does this look like to you?
Moringa.
Moringa oleifera. That is the botanical name. But this is known as Ghanaian Zogale.
Zogale.
Yeah, in Hausa land, isn't it? Did I speak it well?
Yeah. Okay. Zogale.
So Zogale, people knows about Zogale. It's very good. It reduces blood pressure. Okay, so you can add it to your meals. If you're making soup or stews, you can use it. It's very, very good. Okay. Then we have what is known as Benny seed leaf or sesame leaf. You can use it to make sesame leaf soup. But it looks a bit dried up. But can you still recognize it?
Even though some people still dry it off and in fact turn it to a powder and still use it.
Yes.
That's what they call in Hausa karkashi.
Karkashi. Wow. You can use it
Yes.
to make what kind of soup?
Normal soup. It's also like a draw soup, just like the case of...
It appears slimy. It looks like a wedu kind of stuff, right?
Something like
and
that.
I think we have a wedu kind of, it's called jute mallow. Jute mallow. That's the botanical name. So in Yoruba land, it's called ewedu.
Okay.
Use it to make ewedu soup, okay? And it's very good. You can see the leaves.
Yeah.
So if you go to the market, you ask for them, I want ewedu leaf. If you say jute mallow in Nigeria or in Africa, they will be looking at you in the market. Don't say jute mallow.
The jute mallow you mentioned, some people would even mix it with okra,
Yes, you can mix it with okra. In fact, the other day I tried it out. It was very nice, very delicious. Then we have vegetables, like we have a range of them. We have ora vegetables. You know ora? Have you heard of ora soup?
No.
It was very good soup.
But I've heard of
in Igbo land they use it. Oha.
Yeah,
it's either called
soup.
oha or
even
ora.
though I've never eaten it, but I've heard of it several times.
Very delicious. We have bitter leaf soups. We have a variety of soups that you can eat. See, this is ugu. You can use ugu with water leaf and make what they call edikaiko in Yoruba. No, that is Calabar. Edikaiko soup. It's very, very nice. All these things, these are varieties. Some people, they don't know what to eat. You understand? Then this is vegetable. This green.
Yeah.
It's called ganye what?
What do you call it?
What do you call it? Aleho. Yawa. Madala aleho. So this is green vegetables.
Yes.
Then we have this cabbage. Cabbage is very good. You can use it with your carrots and make coleslaw.
That's
you can
right.
use it to make vegetable salad. Okay, but it's important that in every meal you put your vegetables. We also have here some green peas, isn't it?
Yeah.
And then we have green beans somewhere, okay? And then we have green pepper. These things spice up food. If you want to cook your rice, your jollof rice, you can use your ginger here. You know, ginger. And then you have garlic.
Yeah.
I know a lot of people don't use garlic to cook. It's very nutritious. It has a lot of anti-inflammatory properties. It can help with blood pressure. And then with the ginger and then the green pepper, use it to cook your food. So anytime you're cooking, please, you put your garlic, your ginger, your green pepper, and you can spice some spices. They spice up the food, and rather than putting Maggi cube or a lot of salt, it can reduce your need for those things in your cooking.
Okay.
All right. So you need to eat balanced diet containing carbohydrates. Okay, complex carbohydrates, protein.
Okay.
We talked about fish, chicken. Okay, we have what do you call it? Oporoko. What do you call oporoko? What do you call?
I
that
don't know
in
that
English?
one though.
No, there's a name for oporoko. Stockfish, yeah. Stockfish, you can use stockfish. It's very good. Your crayfish, your crabs, they're very good. Then, of course, we talked of carbohydrates, proteins. We have vitamins and minerals, which you can get from this. Okay, and they contain calcium, magnesium, I said, and what? Potassium, which will antagonize the effect of sodium that can cause hypertension. So it will block that effect when you take them a whole lot of them, okay?
Yeah.
And then, of course, your fruits, very important.
Yeah.
From your watermelon to your banana, the banana has potassium, to your what? Apples, you know, a lot of variety of fruits.
You know.
Ensure you eat all those things. And then most importantly, you want to control your blood pressure. Make sure you take your antihypertensive drugs. Once you're diagnosed with hypertension, you must be on drug treatment. Lifestyle modification is what we've talked about. And then your treatment.
Exactly.
You must
And that's
treatment.
why we said in the previous, episodes of this program that the lifestyle impacts greatly on whether or not you get this.
Yeah.
And whether or not you're able to manage it
properly.
for you to live a longer
so
and healthy life.
Your drug treatment is important. Your follow-up is important. See a specialist, okay? And then you must monitor your blood pressure at home. You can't be taking BP drugs. You're not monitoring your blood pressure. You must check your
lifestyle should go hand in hand.
Hand in hand with your medications.
That's right.
Your follow-up, okay? And then don't worry about the complications. You will not have those complications if you can just adhere, okay? Even if you have those complications, don't worry. You will be fine.
Be managed.
We can manage it when you see a specialist. And
That's
you will
right.
just be fine. I think this brings us, do you have any other thing to say?
I think you've said it all.
Yeah, really?
Okay. For me, it's just to say that I'm happy to be a part of this discussion. Because this matter is an important one, because it has caused a lot of problems that people never knew is associated with it. So with this, I believe that people are better informed as to, what this hypertension is, the causes of hypertension, as well as ways they can prevent and control it.
Oh, thank you so much, Mr. Nana Bello.
Yeah.
I really enjoyed this discussion with you.
Yeah.
And I'm glad you guys are all enjoying this show. Do click on the like button, subscribe to this channel, lay your comments in the comment section, and share the videos. Thanks so much for watching. Have a great day.
Healthy living, illness prevention, and health awareness with Dr. Oby Coucou.